methodology. She was saying it the other time. That's on chapter 3, yes or no? That's talking about the blueprint. You may have a beautiful goal that you want to achieve, but for you to get there, you need to adopt a method, yes or no? That is what methodology is talking about. And for you to choose the type of method you want to use, it depends on the kind of study you are working on, whether it is qualitative, whether it is quantitative, or sometimes you may want to blend qualitative and quantitative together. And when you blend the two together, it is called what? Mixed method. Do you get that? So methodology is just simply talking about the blueprint of how you want to achieve what you have in mind. And the components of methodology in your research writing include writing about your setting, the population, the instruments of data collection. How do you determine the psychometric properties of the instrument that talks about the validity and reliability? You also talk about the pilot study, which is a mini study. You'll be talking about the method of data collection, method of data analysis, and the ethical considerations. You know, there is always ethical aspect of everything. You must not be doing anything that is against it. So, under the research design, you know, I've been able to talk about three major design, whether you are using qualitative, whether you are using quantitative, or you are using a mixed method. And there are different types of design under quantity, quality, and the mixed method. Then the setting is talking about the place where you want to conduct your main study. Remember when I was trying to talk about formulation of research titles? One of the major criteria that I said was there is the what? The setting. The setting, the population. So, for the settings, you have to describe the setting where you want to conduct the study. Most of the time, there are some students that make this mistake. For example, let me give a scenario of a title like Factors Influencing the Practice of Exclusive, or Factors Influencing the Uptake of Cervical Cancer Screening among women maybe coming to Lautech Teaching Hospital. Ogumosho does local government. You find out that some students will make a mistake of describing Ogumosho or Ogumosho not. No, you have to describe Lautech Teaching Hospital and that exact unit where you want to conduct the study. Do you get that? Then the population is talking about the people you want to conduct the study on. And when students are writing about population, sometimes they miss population, target population, you know, a research population, they mix this together. They are not the same. Then that will lead us to sample size adaptation, and sampling techniques. That is how you want to choose from those populations that you want to use. For example, if I'm working on nurses in Oyo State, remember you cannot get the population of nurses in Oyo State, or even let's limit it to Lautech Teaching Hospital. You may not be able to use all the nurses in Lautech Teaching Hospital, but how do you sample it? How do you pick from them? That is what is called what? Sampling techniques. And there are different sampling techniques. There is the probability and what? The non-probability sampling techniques. Under the probability sampling techniques, everybody have an equal chances of being selected or being part of the study. While the non-probability, everybody doesn't have the chances of being selected or being part of what? Of the study. Different types of probability sampling techniques, the simple random techniques, the cluster, the stratified, and the rest. Everybody have equal chances of being what? Of being part of that study. That is called what? Probability sampling techniques. Why the non-probability sampling techniques is saying anybody can just be part of it. For example, purposive sampling techniques, convenience, accidental sampling techniques, all of those ones, they are under what? Non-probability. That is what? Sampling techniques. But for you to arrive at your sample size, how do you do that? There are different ways of doing that. Sometimes when the total number of the people you want to work on, if they are not too many, you know, you can make use of total enumeration. When they have many, for example, if they are more than 10,000, more than 1,000, you want to use all of them depending on the objective of the study. Sometimes you may want to use formula. And there are different kinds of formula that you can use. The most popular one that most students always use, and that is what? Taro Yamen. Taro Yamen formula. Leslie Kish, Cochrane formula, the rule of the tongue, 30% and all the rest. Depending on the kind of study that you are working on. Sometimes you see students writing sampling techniques under the sample size determination. They are not the same. And after calculating your sample size, you are expected to have what is called attrition rate. Write it down, attrition rate. Attrition rate means the non-response rate. That is, you know, when you go to the field, for example, with, let's say I'm going to the field with 350 questionnaire. From experiences, we have observed that you will not be coming back with 350 questionnaire. Some people, they will fill it and they will not return. Some, they will fill it just anyhow and it will be useless for you. For you to be able to accommodate that, you are expected to have 10% non-response rate to your sample size determination. Are you getting that? Remember, we are talking about methodology, how you want to achieve the goals, the purpose of the study. Then once you are able to do that, the instrument of data collection, you want to construct it. Most of the time, we encourage students to look for standardized instruments so that you will not be disturbing yourself. Standardized instruments that researchers have worked on, and they have proven that they are effective in assessing what you intend to assess. But peradventure, if you couldn't get a standardized instrument, you can construct an instrument by yourself using the objective of reviewing your literature. So once you are able to do that, putting into consideration the objective of the study, you are to give it to your supervisor, give it to experts to validate for you. Then after the validation, once it is okay, you will go and determine the reliability by conducting a pilot test. Please know that pilot test is not the same thing as reliability. And there are different forms of reliability that you can use depending on the kind of study that you are working on. Pilot study means a mini study. A mini study that will mimic the major study that you want to conduct. Then you need to look for another setting that has the same characteristics where you want to conduct the main study. Are you getting anything? Thank you so much. That is talking about what? The pilot study. And you are expected to use 10% of your calculated sample size. For example, if my sample size is 400, if I'll be taking 400 questionnaires to the field, for my minor study, my pilot mini study, how many will I be using? Thank you. That means you are getting it. You can see, I am not focusing the postgraduate students. I am focusing the what? Undergraduate. This first day is particularly for you. So that by the time you are writing your research, you can write it like a professional. Though you are yet to become a professional, but you can write it like a what? Like a professional. God will help you. So we have been able to talk about pilot study. Then your method of data collection, you have to be explicit. Write it. It will start from how you collect your introduction letter from your department, how you met the gatekeeper, how you collect your data from while I was doing my presentation, my mentor and my boss and my mother, Dr. Mrs. O.P. Adisa, the head of mental and psychiatry nursing department. Please, you are welcome now. Come over to the podium. Please, let's see. Clap your hand. That's our AKB. Mental health and psychiatric nursing department. You are welcome. You are welcome. Please listen. Thank you so much. Thank you. You're welcome. Okay, I believe we are still on the same page. Yes or yes? All right, so quick one.
just want to do a little on the side. Maybe I'll leave my organ. Let's do something. I'll get the upstanding. Please, like the upstanding. What to do? Maybe on the side, just a stand. You know, nonsense are beautiful. So, great, we'll try to put them down. Say, let me say that all ones are not play makeup. So make sure they're not front. We are not done. We are sharp. Alright, so we want to show them that we are sharp. So give it to us. So first, we are the dancer. Don't sound like what they call. We'll be there even when the sun goes down. Let's do it. Alright. Are you doing it? You'll be sitting down since. Your mouth needs to move. Oh, yeah.
Presenting to you data analysis and presentation in nursing research. Data analysis and presentation in nursing research. I believe you agree with me that this is the fourth chapter of our research, chapter 4. And before now, we are going to be free with our instrument to collect our data. And after collecting our data, you can set your data raw. So your data has to be under processing. You have to analyze your data. So this is what you are going to do now in chapter 4 of our research methodology, data analysis and presentation. So data analysis has to do with summarization and interpretation of your data. We are doing this so that we will have full understanding and meaningful information about the information you have gathered in the field. And there are two methods in doing this. We have descriptive data analysis and differential data analysis. Under descriptive data analysis, that involves the use of tables. Use tables to summarize your data, information you have gathered from the field. Not only that, you can as well use tag form of bar chart, and histogram to represent information you have gathered from the field. And mind you, when you are using table, you are not expected to use either buy shirt or buy shirt at the same time. So when you use table, your buy shirt or buy shirt will not be used at the same time. Let's take note of that. So we're talking about the first method of data analysis, that is descriptive data analysis, that deal with summarization and aggregation of your data for meaningful understanding of what you have collected on the field to use your instrument. Of data analysis is inferential statistics. That has to do with the use of statistical method. You know, your chapter 1 of your research, there are some hypotheses you have set. Those hypotheses they have tested, whether accepted or rejected. So under this, that under differential statistics, that will be done, testing of your hypothesis. So that there are some methods. You can either use the test, ANOVA, analysis of the variable, and as well you can use what again? Test here. Thank you very much. So those are the tests that will be carried out.
Thank you very much, the presenter, Mr. Yoyi. Today, just to coin what that aspect is talking about the data analysis and the presentation, and that is usually chapter 4. Chapter 3, we're able to talk about the method. And under that, we're talking about the method of data analysis there. I mentioned the other time that you want to look at the statistical tool that you want to use. Is it chi-square? Is it ANOVA, ANGOVA, or what have you? So, when you have used that, then you want to now analyze the data. You want to analyze the data. The data you have collected, you want to organize them. You want to organize them so that you will be able to do comparison among the variables that you have been able to collect. So when you have done that, then you want to do presentation. You want to present it. It can be in form of table for everybody to see. Maybe you are talking about the gender. Out of 200 respondents that you want to say maybe 30 of them were male, one something were female. So from the table, one could easily see and compare and say, oh, and so forth. This will make one to be able to see and compare those data, information that have been collected from the field, and for one to be able to make helpful information from what you have been able to gather. Thank you.
Thank you so much for the contribution.
Starting from the dean of the department, that is the person of Professor Mrs. Adeyemo, and also the field coordinator, that is Dr. Mrs. Uwema, the head of the mental health department, Mrs. Opia Tisa, Mrs. Dr. Mrs. Amao, the head of medical social campus, and our coordinator for the presentation, that is Dr. Mrs. Olajide. I welcome everyone of us to this academic approach. God bless you. Thank you. So I want to go straight to the presentation. That discussion of findings in nursing research by name is Total of conflict contains that of reproduction, organizing the purpose of finance, write the page, the abstract, write the main body of the report, write the reference, any additional systems, proofread and revise the report, conclusion and the reference. From the introduction, just from all what others I'm talking about, know that nothing research contributes to knowledge, and it plays a crucial role in advancing our evidence practices and generating evidence-based knowledge to enhance patient care and improve the outcome of policy decisions. It also enhances the ability of individuals that are sick, respond effectively to actual or potential illness, intervene in their care, help them recover time. However, adoption research projects is only a part of it's only like a half of the process of research. If the other half that has to be defined not one, then the work is not complete. And what it has to be in a clear, accurate, and meaningful way to our target audience. The first step in reporting the findings and answering is to identify the purpose and the scope of the report. Also, we are also reminded of the main objectives and the questions of the study that we highlighted. We have questions relevant to the topic, the objective of the study. All these ones are very important. Then we are also reminded of our benefactors, leaders that we are directing our research. How are we going to disseminate the report and the people that will benefit from the report of our findings? The identification of the purpose and the scope. We also report for a policy maker. The question that we have to determine the appropriate format we are going to use for the study, length, and the level of details of the report, so that we not just write everything and our writing is covering this